I'm Dr. Kate Rheaume-Bleue. I'm the author of the book Vitamin K2 and the Calcium Paradox, How a Little Known Vitamin Could Save Your Life. I am the host of Global Health Factors, the one-minute news segment on Global National Morning News, talking about good news and research in the natural health industry that sometimes doesn't get the coverage that it deserves. And I am an educational spokesperson for Natural Factors. Vitamin K2 is a nutrient that is so important for health, just as important as vitamin D, and we've heard so much about vitamin D, and yet it has been really overlooked. So for anybody who is taking calcium, anybody who's taking vitamin D, anybody who has concerns about bone health or heart health, these people in particular will benefit from taking vitamin K2 and will benefit from understanding a bit about vitamin K2 and how it really is the missing piece to the puzzle of health for so many different health conditions. So vitamin K2 is a nutrient that does a number of things. One of its main jobs is moving calcium around the body. So after we have absorbed calcium, vitamin K2 will take that calcium and help guide it into bones, where it will help strengthen the bones and the teeth, as well as keeping it out of soft tissues like arteries. So helping to prevent things like hardening of the arteries, heel spurs, kidney stones, and other areas in the body where calcium tend to deposit. So when K2 is lacking, levels in K2 are low, we will tend to see problems like osteoporosis, leaching of calcium from the bones, or increase in calcium in other areas leading to problems like arterial plaque. Current clinical trials for vitamin K2 in the form of MK7, minoquinone 7, which is a very convenient form of vitamin K2 to use. Clinical trials on bone density are using approximately 180 micrograms for daily dose. The most recent clinical trials for arterial calcifications, reducing arterial calcifications, have used 360 micrograms per daily dose. Now, Health Canada limits any individual product sold in Canada to a daily dose of 120 micrograms, and so you'd have to double or in some cases triple that daily dose. But study after study has shown that vitamin K2 is very safe and non-toxic. Vitamin K2 is available on the market in two different forms, one called MK4 and the other one called MK7. Both of these forms work, they're both effective, but they both have research behind them, but they need to be used each in their own appropriate doses. So MK4 has been shown to be helpful in relatively high doses. Studies with MK4 have used 5,000 micrograms up to 45,000 micrograms, and showing good results with those high doses. However, in Canada, we are limited to doses of 120, so you'd be literally taking handfuls of pills a day to get that kind of dose. The MK7 also works. The half-life of the MK7 is a bit longer in the body, and so you can benefit from MK7, this form of vitamin K2, in much smaller doses. Studies have been conducted with 100 micrograms, 200 micrograms, and as I was saying, 180 for bone density, or even up to 360 for other health concerns. The MK7 form is useful in even these small doses. Vitamin K is a critical and overlooked nutrient for bone health. We've heard a lot about vitamin D. Vitamin D helps us absorb calcium. That's a main action of vitamin D, and of course that's important. Vitamin D does other things for our bone health as well. However, once we have absorbed calcium, vitamin D has no control over where that calcium goes. The role of vitamin K2 is to take that calcium and guide it into the bones where you want it and help keep it there. So vitamin K2 is a critical nutrient for bone health, and the clinical work so far, clinical studies have been very promising in terms of increasing bone density and bone strength with vitamin K2. Anybody who's taking vitamin D should be taking vitamin K2. These nutrients complement one another and work together. When you take vitamin D, you actually increase your body's need for vitamin K2. And so although you can take K2 on its own, and many studies use it in that way, if you've been taking vitamin D, then absolutely K2 should go along with that. So for people who are already taking vitamin D, vitamin K2 is available on its own in 100 microgram doses, or it's very convenient to take vitamin K2 and D together, and that's available in soft gels with 120 micrograms of vitamin K2 along with 1,000 international units of vitamin D.